I'd like to welcome everybody to the December meeting for the Pitt County Board of Health. We will start with a roll call with Ms. Betsy Wallace.
Tom Colson. Tina Dixon.
Present.
Martha Engelke.
Present.
Rex Fleming. Herbert Garrison.
Here.
Mark Hayes.
Here.
Scott McIntosh.
Present.
Natish Patidar.
Present.
Kelly Pack Smith.
Present.
And Lowell Spate.
Here.
We have quorum, Chairman.
Great. Next, we'll hear any public comments. Seeing none, we will review the minutes from the November meeting. They've been circulated previously. Any corrections or additions from the board? Seeing none, we will seek an action or a motion to approve.
So move.
Second.
And the minutes pass. Next, we'll go to the fiscal report with Marcia Hall.
Hey, everybody. Hope you can hear me okay. Just wanted to talk to you. We are talking about the fifth period of ending in November. And I'm hoping you can see that okay. Coming to you remotely. This was sent to you, emailed to you. We did have some budget amendments. One in particular, just wanted to mention to you, the Nurse Family Partnership received $71,000 from the CARES funding. That was separate from any of the county CARES funding. It was for the North Carolina Pandemic Office, which is really good for that program. They rarely have enough money to do a lot of incentives, and that program receives no county funding. We did have a decrease in tobacco. That was just the way the CDC grants. So we had an overall increase of $67,083. As we move across the columns, we are actually looking fairly good. Period 5, the clinic and the Medicaid revenue is a little down. We did have to reapply for an NPI number for the dental. You know, we've installed Dentrix, and so that's taken a little bit of time to get some of the Medicaid revenue in. We still are running mandated services, so we kind of expected the decrease in revenue with Medicaid. We also, clinic fees are a little bit down, and state funding has a negative 114,000. And with state funding, you know, our programs are running at a minimum right now. So you have to spend it before I pull it down. And some of the COVID funding that we did receive will expire the end of December. So we do have some expenses in December that should catch that up. Overall, we have a surplus of 1.159 thousand, if I'm seeing that correctly. So adjusted, we're sitting okay. If anybody has any questions, there's a lot of moving parts to this, of course, so I'm happy to answer any questions about it.
Any questions from the board members?
Yes, I have a question. Marcia, I don't know if you're going to cover this in a future topic or not, but I was in another forum and the question came up about whether there was an opportunity to request additional CARES funding, or if there was, some other provisions being made going into the new year.
So, to be honest with you, we have spent some time looking at there's been so many emails basically begging people to apply for CARES funding across the board. The problem is the double dipping part. So if a lot of our COVID testing supplies have been paid for by the CARES funding that the county received. So you have to be careful making sure you don't double dip if you've received CARES funding in another source. And it's really hard to tell, except for like Nurse Family Partnership, we were able to say that they did not get any CARES funding because they're not county supported. I don't know if I explained that very well, but as things come up, we are really trying to research it. But it's really hard to make sure you don't double dip because some of the state funding we're getting is also CARES funding for some of the programs. Yes, ma'am.
Does that answer your question, Kelly, or do you have a follow-up?
No, it does answer my question. Thank you.
You're welcome.
Other questions from the board?
Move to approve.
Second.
All right, and the fiscal report has passed. Marcia, do you have other information?
Just wanted to mention that our grants, at the end of November, we have a $321,273 balance. And some of our Vidant grants, it's time to renew. So we'll be applying for those as well. And we've also, the dental, Smile Safari has applied for a Delta Dental grant this December to help us with equipment. We received that last year as well. So we're hoping that will be approved again. I did send you the position report. You will see that there's more than 20 positions listed. Right now, we are saying that there's 20 vacancies, and that is because 2 or 3 of the positions, the funding expired on those. We have those listed just for your review, but we have 20 vacancies at this moment.
Thank you, Marcia. Any other questions or comments from the board? All right, seeing none, we can review any items of old business from the board. We have none on the agenda, but anything anyone wanted to discuss? All right, we'll move on to new business with the Annual Communicable Disease Report with Lee Cutler.
Good evening, everyone. My name is Lee Cutler. I'm the Communicable Disease Supervisor at the Pitt County Health Department. And for a few minutes, we'll get to take a break and not talk about COVID. So we'll talk about some of the other communicable diseases that have been around for a little while. So this is the 2019 Communicable Disease Report for Pitt County. I will be the only one presenting this evening. The program coordinators will not be here tonight, so it'll just be me. And just to give a brief overview for the authority of the health department, we are given the authority by the North Carolina General Statute, Chapter 130A, Article 6, which that gives us the obligation to report communicable diseases, the authority to investigate the communicable diseases and issue control measures, as well as to exercise quarantine and isolation authority. And our overall communicable disease program objectives are basically to control the transmission of any communicable diseases with whatever appropriate prevention and treatment, and also to detect cases in the community as well as monitor these trends of communicable diseases. The communicable disease services that we provide include surveillance for these general communicable diseases, as well as our sexually transmitted disease or STD communicable diseases. And that's done through our NCED's electronic database system or paper-based system that people in the community fax to us. And then our other services are the prompt investigation of these outbreaks or other communicable diseases. It also includes the implementation of control measures that are stated in the public health laws, providing any post-exposure prophylaxis that may be necessary, and also providing health education services to the community. It also includes maintaining close communication with our public health agencies, as well as the private physicians, hospitals, any occupational infection control personnel, school-based health reporting agencies, and also providing a 24/7 communicable disease reporting line for healthcare providers. Under our broad umbrella of communicable diseases, one of our programs is our STD program, and these goals are to monitor the STD rates and trends in Pitt County. The main one is to ensure the adequate treatment of patients, whether they were seen at our facility or not, to ensure that they were treated adequately. And then also timely reporting to the state's communicable disease branch using our NCED system, which the overall goal of that is then for reporting to the Centers for Disease Control. Within our STD program, we provide confidential sexually transmitted disease exams, the confidential testing, treatment, and counseling, and also referral for treatment if necessary. For 2019, our STD case rates, if you were to go back and look at last year's, they've increased somewhat, but this is not only for Pitt County. This has been statewide as well as nationwide. So the largest proportion of our cases come from chlamydia. The second largest portion is gonorrhea. Then we have NGU, which is non-gonococcal urethritis, no PID cases, and then a smaller proportion of syphilis cases. This slide that you can see right here is our demographic distribution. The largest proportion for gender is female. The largest proportion for race is African American, and our largest proportion for ethnicity is non-Latino. Our chlamydia cases, as you can see, this has gone from 2015 to 2019, a little over 200 case increase from last year. So we had 2,232 for 2019. Our gonorrhea cases, again, about a little over 200 case increase for 2019 from 2018, with a total of 860 cases for 2019. For our HIV and syphilis services, we offer counseling, follow-up, and referral for that as well, the investigation of disease control measure violations, and partner notification services for anyone that's tested positive for syphilis or HIV. Our HIV case count went up as well from 2018 to 2019. And again, that's not just strictly for Pitt County, that's a statewide increase as well. However, our AIDS case reports did go down from 22 to 18, from 2018 to 2019. And our syphilis case numbers have gone down as well from 2018 to 2019, from 47 to 36. Another program within our large umbrella of communicable diseases is our general communicable disease program activity. And under the general communicable disease programs, that includes the foodborne diseases, bloodborne diseases, and vector-borne diseases. And these are the ones that probably require the most time in investigation, surveillance, and data entry. And you can see we had one less case in 2019 for hepatitis B than 2018. For chronic cases, and then we had one acute case, and that was a one case increase for acute cases. For hepatitis C, we had a decrease in chronic cases, and we had a one case decrease for acute cases from 2018 and 2019. Our Campylobacter infection stayed the same as far as for the confirmed cases, a 3-case decrease between 2018 and 2019. And the difference between a probable cases, about the only difference is that they probably did not have a culture test done, but everything else meet the case definition. So the probable cases take just as much time and energy and effort to determine between probable and confirmed. And this is the same for all the other slides I'll show as well. Salmonella, we did have an increase from 11 to 28, and that could possibly be just from more people going to be seen by physicians for the symptoms that they were having, and then the physicians actually testing for it. Shigellosis, again, that had an increase as well, and that's the same as the salmonella. Most likely increase is due to people being symptomatic and then people being tested for it as well when they were being seen. Our spotted fever, which otherwise was known as Rocky Mountain spotted fever, we had 6 probable cases. Lyme disease, we had 2 confirmed and 4 probable for 2019. In ehrlichiosis, we had 1 suspect case, and the last time we had a probable case was back in 2017. Some additional CD case investigations. We had 2 confirmed cases of adult flu deaths and then 1 confirmed case of a pediatric flu death, and that was as of August of 2019. Another program is our immunization program. And the main goals of our immunization program are basically to reduce the spread of vaccine preventable childhood diseases by ensuring individuals are age appropriately immunized, managing any outbreaks of any type of vaccine preventable disease, as well as providing health education to the community to help improve the immunization rates and also to promote protection via cocooning. At the health department, we provide immunizations that are no cost to vaccines for children, eligible children. There are certain qualifications. Immunizations for adults, those could vary. We accept Blue Cross Blue Shield, MedCost, Medicaid, and Medicare. We also provide post-exposure prophylaxis for rabies, and the NCIR is our North Carolina Immunization Registry, which that's the database where anyone that's immunized, their information goes into NCIR, and if anyone needs copies of their NCIR reports, we're able to provide those to individuals if their information is in NCIR. And the immunization compliance rate definition is just basically the percentage of children who have the documentation that are up to date by 24 months of age with the 19 recommended doses of vaccines. And the little chart to the right are the different vaccines that are recommended, as well as the number of doses of each of those vaccines that a child is supposed to receive. And for Pitt County, the Healthy People 2020 goals is 80%. And you can see that we have reached that. And as well as the 2019-2020 goal for Pitt County Health Department, we reached 90%, and the Pitt County total is 79%. And when I say Pitt County Health Department, those are the patients that come to see us, that we're their provider. And so the percentage of meeting the benchmark, that has been extended to December 31st due to COVID. This year, and people not being able to get in possibly and get immunizations because of clinics being shut down and inability to see providers. So again, I don't have a percentage of meeting the benchmark for that at this point in time. Another program is our tuberculosis program. Basics of that is to basically eliminate tuberculosis as a public health threat by reducing any new number of cases of TB, as well as controlling the spread of tuberculosis in our general population. We provide the surveillance, case and contact investigation for TB cases, and then also direct observed therapy, treatment of contacts, as well as ensuring isolation and other control measures of tuberculosis for people that have active TB. For the year 2019, we actually did not, we had 52 cases of latent TB infection cases, which meant someone was diagnosed with latent TB, meaning they were not an active infection or they did not have active disease, meaning they were not infectious to anyone. We had 0 cases of new TB disease. And then there was 1 case that was being followed that was, it had transferred over from 2018 into 2019. So that person finished out treatment in 2019. And in summary, the factors that basically impact the effectiveness of our communicable disease control efforts is basically the ease of access to quality health care for our population, timely access, trying to increase community awareness and education regarding existing and potential health threats, and then having community partner collaboration with other entities in our community. And for the past, you can see on the slide the different goals that we've had a focus on. And from 2017 to 2020, it's somewhat stayed the same, as basically our goal has been to try to increase efficiency of our clinic services, as well as improve our outreach efforts for prevention of early treatment of disease. And we have hired a communicable disease health educator. So that hopefully will help with trying to improve outreach efforts. And again, a lot of our goals have remained the same from 2015 and that's supposed to say to 2020 due to staffing. Just sometimes losing some of our nursing staff and trying to get those filled, and just some of the turnover rate. And this slide has our communicable disease program staff. Myself, the supervisor, Lee Draper's our immunization coordinator, Christina Forget is our communicable disease coordinator, Renee Williams, our STD program coordinator, Michelle Jones is our TB program coordinator. Her last day is this Friday. Toria Wilson is our disease intervention specialist, and Dr. Kimberly Hardy, who is our public health division and nursing director. And that is it, if anyone has any questions.
Thank you, Lee. What do you expect to see for the 2020 numbers when you start unpacking it, as far as the rates of communicable disease with people staying at home more due to COVID? And
as of looking at the numbers today, I think probably some of the STD rates will go up. More people are at home. Just as of right now, kind of comparing, I think it was August, September, and October, those numbers were higher for this year because we have those numbers now. Those numbers were higher at this point in time this year than what they were last year and maybe the year before as well. So I think there'll be possibly some higher numbers for that. We'll see. Any other questions?
looks like Marty's got a question.
Okay.
Lee, do your numbers include the cultures that are done at the hospital, or are those just the numbers that are done at the health department?
Those numbers are for all of Pitt County. Are you talking about in general, like cultures just in general for any communicable diseases?
Or for the STDs?
I mean, all these numbers that are up here are for all of Pitt County, whatever has been reported for Pitt County from whatever entity did the testing.
Thanks.
My question was similar to Adam's, and I also wondered about immunization rates. What are you seeing as far as immunization rates for kids?
We've been working on the immunization rates. I don't have specific numbers right now. I know that we've provided different immunization clinics in trying to get some of the ones that are not up to date. We've provided different immunization clinics. Again, I think COVID has some people scared to come out and about. Like we're doing our best to get, we're still holding immunization clinics. Actually, we have several different ones coming up for the future. Sometimes I know some of the dates have been pushed back as well. And typically from the past that we've seen, when dates are pushed back to say people have a little bit longer time to meet the requirements, then typically they push their time until the last minute.
Other questions or comments from the board? All right, we need a motion to approve Lee's report.
So moved.
Second.
Tina, did you have a question or a comment?
No, I was going to move to approve.
Great. All right.
Thank you.
Lee. Next up, Amy Haddam is going to introduce a new employee, Abigail Hubbard, who is our emergency preparedness coordinator.
All right. Good evening, Mr. Chairman and board members. It is with great pleasure that I get to introduce our new preparedness coordinator, Abigail Hubbard. Abigail began with us on October the 19th, just in a timely manner to help us continue our response to COVID. Abigail is a graduate of ECU. Both her undergraduate degree is in public health studies and her master's degree. She has a master's of public health from ECU as well. She comes to us from ECU Wellness Program, where she was formerly employed. And I can certainly say she has been busy since day one. She hit the ground running. She has been oriented every day with our health department orientation, as well as the state preparedness orientation. And she has also spent many hours manning our COVID hotline. So tonight she is going to share a data overview of the COVID-19 hotline that has been operating since March. So it's my pleasure to introduce Abigail Hubbard and ask her to come and provide that information for you.
Thank you, Amy.
Thank you. Hello, everybody. I'm happy to be here and share some of the information that I have about the hotline room. So we'll just jump right into it. The first slide that I have for you guys are all based on raw data. So you'll notice that again, it was started in March, the hotline itself, and then you can see from the raw numbers of total calls all the way up through November. So we kind of wait. I have some December numbers right now, but I wanted to wait until it was collective enough to share with you all. And the spike observable, you'll notice from June to July, is likely due to the initiation of the community testing from the health department. And then in September, the peak, probably due to the fact that that's when we had our largest amount of school-related calls. This slide will show how we group the calls that come into the hotline room. So businesses, medical, public, and school. And the businesses and medical are typically employees or providers at those organizations, where school are typically the nurses or administrative bodies. And then public are all the other calls that come into the hotline. So you'll see on this chart, I thought it was a little easier to see the numbers of the raw data as it goes from March to November. I think some interesting things to point out are the jump from June to July that I mentioned, 357 to 1,198, and then the peak in September of 32 calls. And you'll also see that the business and medical calls that we received in March, they are 120 and 126 respectively. And then you will see the November calls go down to 18 and 28 respectively. So we think that they kind of figured out their regimen and how they work with the regulations. And then this graph will show, or the two graphs switch from raw numbers to percentages as they are compared to their respective month. The first 4 months generally will look a lot like March in the way that it is distributed from the call types. And then the last 5 months resemble November. We do think that is because of the March to June hotline being open, and then July to November, the hotline, as well as testing being available. We did realize, though, while digitalizing the data, that we probably need to start breaking it down into more specific categories to increase the accuracy, and we'll be doing that from December forward. This graph also utilizes the percentages with the respective months, and I just thought that it would be easier, instead of showing you all of the pie charts that we have, to put it into this graph. I did not include the percentages for school, that yellow line on the bottom, simply because it is a busy graph already, and because from March to August, it was consistent at 0%, and then spiked in September to 2% and leveled off again at 0. And so then you'll see that, like I mentioned, from March to June, that is just the hotline being open. And then when it jumps to 93% of the calls being public, that is when the hotline and the testing were available. And then just to give you an idea of some of the public calls, which is our largest call type category, some of the scenarios that we go through, which I would say are the largest portion of the calls we receive. So for example, I was exposed a week ago. I've been to 20 parties, church, and my grandma's house. I don't wear a mask or social distance. What do I do? And then where to get tested, where they can find rapid testing in the local community. How long is their quarantine, which changes a lot because of CDC guidelines. And then do my family members need to quarantine? And a lot of reporting about not following the governor's mandate in workplaces, restaurants, gyms, and businesses. It's just a little bit of overview of that category. Any questions?
Thank you, Abigail. Any questions from the board members for Abigail? All right, welcome on board.
Thank you.
Thank you so much. Next, we'll have our health director's report with Dr. Silvernail.
Good evening, folks. The reports of my demise are exaggerated. And there we go. So did this a little different format for you all tonight. Based on a report that I gave to the county commissioners last night. So let's jump right into it here. We're going to start off with the course talking about COVID-19. Where are we? This Thursday marks 38 weeks or 19 incubation cycles since the first case of COVID-19 was identified here in Pitt County. Our case counts as of 11:30 hours today December 8th, 2020, we would have 1,260 active cases. Those are the cases over the past 14 days. We are averaging 90 cases per day for the last 14 days. If you do the math, while the state reports this in cases per 100,000 and cases per 10,000, I think for residents in a county, it's easier to think about it in cases per 1,000. And that number is 6.8 active cases per 1,000 in Pitt County at this time. If we look back to October, this rise started probably a week or two after Halloween and the election. We started to see case counts climbing. If you look back before that climb began, we were down in the maybe 3.1, 3.2 range for active cases per 1,000 in Pitt County. So we've more than doubled that in the past month. Our total cumulative cases at this point is 8,791. That represents about 4.8% of the Pitt County population. Excuse me. There are some estimates out there that this disease may have a footprint of 10% or more in the community, but we don't have any data to support that at this time. We would estimate that about 7,743 individuals have recovered. That's 88% of the cases are considered recovered at this time, and that's based on timing out. So when a case hits day 15, we consider that case recovered. We have accumulated 58 deaths during that time period. Many of those deaths are in the 75 and older age group, and to date we have not had a death below the age of 50 that I'm aware of. Our case fatality rate is stable at this point at 0.7, unrounded at 0.65, which was actually down a hair from yesterday. But we've been reporting that to one significant figure, so I throw the rounded number in just to kind of show you where we are unrounded. During this epidemic, the range for our case fatality rate in Pitt County has been from 0.5 to 0.7. So we're back at the high end. As more non-fatal cases come in, that will tend to drift back down. Our test positivity rate per the state today was 9.9%. Looking back on that same time frame to October before this current surge began, we were down about 6%, hovering around 6%. By comparison, last spring, when we had kind of settled down after the initial wave in Pitt County, we were settled at about 7% positivity for several months prior to the ECU spike, and then came down to that 6% range. Now we're back up at 9.9, still a little bit better than the state as a whole, but not where we would like to be, obviously. Want to break down and show you this distribution of cases by some different categories here. These graphs come from a NC Edge report that I get every week on Wednesday. So this is last week's report. This graph shows cases per week. You can see the date of the week along the bottom. The blue portion of the bar represents cases not in congregate living. The orange or salmon colored part of the bar represents cases that are in congregate living. So you can see we had a little bit of activity, at the end of May, beginning of June. We had a very low level through the summer. Towards the end of August, we had some activity that came down into early October, had another little bump of that, and then that has fallen off. And this correlates to where we started to get good testing throughout all of these long-term care facilities for both staff and faculty, or staff and residents, not staff and faculty. So we've done pretty well with keeping those numbers low. Unfortunately, even with low numbers in this population, those are high-risk patients, and often they are significantly impacted or severely impacted by COVID. Next graph shows this data, same curve, but broken down by race and ethnicity. The red bar along the bottom, reddish or orangish bar along the bottom, is the proportion of cases that are African American. You see early on that was a big proportion of our cases. As time has gone on, that has stratified out, staying pretty level, although recently there's been a little bit of a drop off in African American cases. This sort of slate blue color are whites or Caucasians, white non-Hispanic, and most recently that's been our biggest bar. This purple or lavender colored bar are Hispanic. The green is other, and then the top, that's unknown. So we have a group of other in there, very small proportion of Asians in the mix here. Very hard to even see that on the graph. But I was glad to see the drop off in African American cases here recently. This is looking at the same data stream by age. Couple things to look at in this sort of purple or lavender at the bottom are our 0 to 17 age group. So this represents the vast majority of our school age kids. You can see looking at that we've had a little bit of oscillation in it up and down, but overall it's been mostly steady, even with the return to school and then with the return to in-person for K through 5 has been mostly level. When you look at that on the state website as a percentage, it's about 10% of our cases. There may be just a very few of our school age kids who are in that 18-year-old group. But this is predominantly that 18-year-old group is our college and graduate students. Before the ECU spike, the younger working adults, the 25 to 49-year-old group was our biggest group. After the ECU spike, we have gradually returned to that. And again, where we're seeing case growth is in that 25 to 49-year-old group, sort of that younger adult age group. This next graph shows number of tests per week versus percent positivity. I would disagree with the state. We were a little higher than this by our internal calculations back in mid-April. It was on or about April 15th that we had hit about 21%. The numbers were small at the time, but from there we tracked the descent to about 6% in our internal calculations at the time. This is the ECU spike where we hit up into the high teens. And then after that, we came down and again sort of leveled out around 6%. And you can see again, beginning around Halloween, we started this climb upward in our trends for percentage positive. The next graph shows cumulative tests per week. I added the bars to make this easier for you to see. The sort of orange colored bar is the 4,000 test line. The blue bar is the 6,000 test line. And you can see we have been above 4,000 many, many times. Beginning about the week of October 10th, we were well above 4,000 across there, many times above 5,000, and even had one where we were probably around 7,500. And that looks like that was the week before or of Thanksgiving, where many people got tested before they went off to see family members. So I am very pleased to see where we have gone with our testing. I've mentioned to you all before, the state recommends that as a county, we should be testing about 5% of our population per month, which would be around 9,200 individuals. We are testing in excess of 20,000 individuals across all providers here in Pitt County, and I'm pleased with that number. Talk about our Pitt County testing just a little bit. Testing is widely available across Pitt County. All of the major medical groups, most of the urgent care centers, 3 CVS pharmacies are doing testing. Biden Health has its testing site up and running near the former Wellness Center, ViQuest Center. We have our site. We'll talk about our site. The federal DHHS funded surge site has been up and running since the end of October. I guess we started that. That is running well at Sycamore Hill. Unfortunately, that will close on December 16th. The Guard were only extended through December 17th, so they will work until the 16th, and then on the 17th, they must report to the Guard headquarters for out processing from this deployment. But that's been a good site. They have a capacity there of around 150 tests per day, and I think they're getting close to hitting that most days now. I received an email late last week from a concern known as Groundwater Solutions Genesis Project. This is funded through the North Carolina Department of Health and Human Services. And this group will be coming to Pitt County to open sort of movable or mobile sites in Pitt County to target the minority community and other marginalized communities here in the county. And that's going to start in the near future. There's also been some discussion between myself and the North Carolina Department of Health and Human Services about using some sort of vendor-driven site to augment testing in Pitt County. Our site will continue to operate as currently scheduled through December 17th. After that, we will continue testing as part of our contact investigation and tracing, and that will go on probably indefinitely, or at least for the foreseeable future. Our testing crew is going to have to pivot to COVID vaccine administration, and that will likely happen during the week of December 21st. We've been told that vaccine will likely come to local health departments the week of the 21st, and we will begin vaccinating individuals here in Pitt County. Influenza vaccinations. Pitt County Health Department will be hosting a series of community influenza vaccination clinics throughout the month of December. We have already provided influenza vaccination clinics for the town of Bethel. That was at the opening of their new youth center a couple of weeks ago. And at the ECHIM program, that was during their weekly operation. Both of those were successful. ECHIM, we hit, I think, what we thought we would hit. The Bethel program was a little less than what we would have hoped to do up in Bethel, but we did get a few folks vaccinated up there. There have been at least 2 studies out there that have shown that COVID-19 mortality is decreased in communities with high rates of influenza vaccination. Dr. Hardy, our nursing director, is leading that effort to get this influenza vaccination program going. Our staffing issues, Marcia showed you or told you about our vacancies. I reported this to the Board of Commissioners last night. By week's end, we will have 7 vacant full-time nursing positions in the personal health division. By week's end, we will have 2 vacant physician extender positions. Those are both for family nurse practitioner positions. I do want to wish Sandra Parks, our senior clinician, a happy retirement. Sandra's retiring officially at the end of the month, but going to take some vacation time between now and the end of the month before her retirement becomes official. But her last effective working day is Friday the 11th. We've been unable to fill the vacant environmental health division director. This was because of salary demands that were above what we could offer in spite of having two very qualified candidates for that. We have a number of other positions across the department that are open, 20 as stated. And these vacancies are affecting the work that we can do. I know Commissioner Colson's not on the call. This is not because the manager won't let me fill these positions. We are simply having trouble getting folks to come to work for the health department. I think this, to many people, is probably not a good time to come to work for the health department. COVID has imposed a tremendous burden on local health departments, and people, I think, are reluctant to come to work for us in the middle of this. I want to finish off by mentioning a couple of our seasonal activities, and on a little higher note tonight. First seasonal activity, you're all familiar, or many of you are familiar with the Polar Express themed event we held last year. It was a WIC Fun Day where we served healthy seasonal treats. I read the Polar Express to children. Our staff had a blast doing this. Obviously, we can't do this year because of COVID-19 and social distancing, but we will be doing a recording of the Polar Express for local children and putting that recording out virtually, across our social media, YouTube channel, things like that, so that it is available for children to hear the story if they would like to hear the story. The other thing that we do annually, this is something I've done at other places that I've worked. Ernie Davis, Ernie was the first African American to win the Heisman Trophy. Ernie's one of my personal heroes. We will hold an internal celebration for Ernie on December 14th, the anniversary of his birthday, and I'll provide some healthy treats for our staff to enjoy that day. And eventually, we hope to make this a public event in the future to celebrate the life of this great man who deserves to be remembered, but unfortunately has largely been forgotten by history. And that's the end of my report. I thank you for your attention. On the right side of your screen, you'll see a quote from one of my fictional heroes, Doctor Who. This is the mentality I've tried to bring to the health department and adopt for the health department, in that in 900 years of time and space, I've never met anybody who wasn't important. And I thank you for your attention. Happy to take your questions.
Thank you, Doc. Any
Dr.
questions or
Silvernail.
comments from the board members?
I have one question. In your report, you reported 58 deaths, and when I was watching the news, I noticed that Vidant is reporting like 200 deaths. So I don't know, are you reporting only Pitt County residents, or are their numbers different than your numbers?
No, Dr. Hayes, we only report Pitt County residents' deaths.
Right.
So what they are reporting are deaths across the Vidant system, which includes residents other than of Pitt County. So for Pitt County, we report Pitt County residents, and in that surveillance, from a public health surveillance standpoint, only those individuals who had a positive COVID test and meet a surveillance definition are reported in that public health surveillance. There are deaths and vital statistics in what we would say, death certificates, which are our vital statistics, that suggest that the death toll may be higher. But from a state surveillance standpoint, we're only reporting confirmed COVID-19 deaths.
Thank you.
You're welcome.
Hey, Dr. Silvernail, this is Lowell. Hope you're feeling better. Sound like you are. My question is, when the Pfizer vaccine comes in, what's our plan to maintain the temperature, the minus 70 degrees that they're requiring? Are you going dry ice? Have you got that kind of set up?
Well, I hope we don't get that one, Lowell, to be honest.
Okay.
The state is trying to send the Pfizer product, which I have nothing against the Pfizer product. That, from what I understand, it's an excellent product. But the cold chain storage is a headache, and they're trying to give that to the hospitals and healthcare systems preferentially over local health departments. If we do get it, it is shipped in a dry ice storage system. And my understanding on that system is that it gets replenished upon arrival and then can be replenished twice after that to maintain that storage.
Yeah, actually, I think it's a little more than that, but yeah. And then it can go in the refrigerator for like 5 days, I believe.
Once it's reconstituted, once it's thawed and reconstituted, it's stable at refrigerated temperatures for 5 or 7 days. I have to look at that.
5 days. Yeah, I've looked at it. Don't worry. 5 days. Yeah. Okay.
So that adds some technical challenges for us. If we were to try to go out and do this operation in the field, we can maintain the refrigeration pretty easily out in the field. That cold chain, so the vaccine is going to need to be stored at the health department, reconstituted, and then likely refrigerated if we were to go out and do that. The first group to get this would be local first responders from us, and we would likely do that in a drive-through fashion at the health department, so we could bus that from our vaccine storage area out to the curb easily to administer that to folks coming through in that first responder group.
Thank you.
You're very welcome, sir.
Hey, Dr. Silvernail, I thought one of the most curious things you said was that there had been some reports of decreased mortality with COVID in patients who got the flu vaccine. I was wondering if you would if I heard that correctly, and speculate as to why you think that might be.
Yeah. It's not that's Herb, I can't tell you that in Dr. Garrison. I've known you for too long. I think you probably feel the same way now. These are not necessarily that there's an individual effect, Herb, but there seems to be a community effect. And there were two studies, and forgive me, but I don't have the references with me tonight, where in communities that had higher rates of influenza vaccination, the COVID mortality rate was lower in those communities. I guess you could speculate that when you vaccinate somebody, or even when you have an infection, our body does produce some non-specific antibodies as part of that process in terms of recognizing that antigen and responding to that antigen. Maybe that's where it is. Maybe there's some sort of immune priming effect from influenza that goes when you vaccinate folks that primes their immune system to better process the antigens from COVID. It's hard to say. So it was kind of a community type study, an environmental type study, looking at, what's the influenza vaccination rate versus what's the COVID death rate, and the finding was that the COVID death rate was lower when the influenza vaccination rate was higher.
Thanks.
You're welcome, sir.
It's like Kelly Pack Smith's got a question.
So, Dr. Silvernail, you mentioned kind of in line with what Dr. Garrison was asking about the offering flu vaccines. So are there any problems or interactions between the flu vaccine and the COVID vaccine and giving those in close proximity to each other or at the same time?
Not that I'm aware of, Kelly. I probably wouldn't give them both simultaneously. Anytime you vaccinate somebody, you can have, a mild vaccine reaction that may include some fever, some chills, aches, sort of that generalized malaise, similar to having the infection itself. Because there's concern about the side effects of the corona vaccine, I would probably do them separately. Some of the corona vaccines also require a booster, so it's like day 0 and day 21 or day 0 and day 28. So I would want to get folks vaccinated for flu now early and then move on to the COVID. I'm not aware that you couldn't do them together, but it would be hard to sort out the side effects. And generally, when you do things on an emergency use authorization, we are going to be required to track the adverse events. And so if I give you a flu shot in one arm and a COVID shot in the other, and you don't feel good for a few days after that, which one made you not feel good? So it would be cleaner if we could do them separately.
Thank you. And last question. So is this an intramuscular administration? Is that what the COVID?
I believe so, Kelly, yes.
Okay.
Dr. Engelke, did you have a comment? I see your hand is raised. I think we're trying to get you on.
It was really about the other report. I was just curious about when they get these questions about employers and places they go and they don't feel safe and that people are complying, what they tell them, because people ask me that too. And I don't know what to tell them. So I was kind of interested in what the advice they give on the hotline. Maybe Dr. Silvernail.
Abigail's coming up now, I think. Hold on. She can answer it.
Oh, okay.
Hello. Yeah. So normally if they are listing a workplace or restaurant, a gym or business, we ask what the complaint is, whether or not they're wearing masks. A lot of the times we'll get that they're not wearing their mask or the correct way, so under their nose. And we always like to say that we're not in the business of enforcing. And so we will give them the number for either the sheriff's office or the Pitt County Police. But then again, we do, if it's a thing that occurs more than, 3 times, we do pull in Amy and Dr. Silvernail. So, yeah.
Thank you.
Thank you, Abigail. Other questions or comments for Dr. Silvernail? All right. I think that's it for tonight. Does anybody have a motion to adjourn?
So moved.
Second.
Second.
All right. And none opposed. We will get you guys out of here. Thank you for your time. We'll see you next month.
Good night.
Thank you.
Good night, everybody.
Good night.
Good night.